everyone. We've all heard the phrase, it's just stress, thrown around when it comes to chronic illness. But what if the real mind body connection isn't what we've been told? What if the stress is hidden and we aren't even aware that it's there? Today's guest is here to shake up what we think we know about emotions, health, and even hypertension. Yes, that supposedly straightforward blood pressure problem that so many of us face. If you're tuning in for the first time, I'm Raelan Agle, and this is where we dive into the real, unfiltered stories of ME/CFS, long COVID, and other chronic conditions. No fluff, no gatekeeping, no outdated ideas, just what actually works. Today, I'm excited to be joined by Dr. Samuel Mann, a physician and professor of clinical medicine in New York at Presbyterian Hospital, Weill Cornell Medical College. Dr. Mann spent decades at the top of his field, optimizing drug therapies and publishing research in leading medical journals. But along the way, he noticed something unexpected. While most cases of hypertension had nothing to do with emotions, a subset of patients did have a mind-body trigger. And the most surprising part, repressed emotions can exist in people who don't even feel emotionally distressed. So yes, your body can hold on to stress even when your brain, your mind, is blissfully unaware. His insights don't just apply to blood pressure. He's discovered they're relevant to conditions like ME/CFS and migraines and more. I'm so excited to hear what the research has missed, why this discovery remained hidden for so long, and how this understanding could completely change the way we think about chronic illness. Dr. Mann, wonderful to have you here. Thank you so much for doing this.
Thank you for having me.
But before we dive in, I'd like to thank ClickUp for sponsoring this video and helping me consistently bring you quality content at no cost to you. I know that I am not alone here. Many of the people I interview here on this channel decide to become entrepreneurs and start a new career coaching or creating programs or courses to help others who are facing the health conditions that we talk about here. ClickUp provides an all-in-one platform to help you navigate this, improving workplace efficiency and collaboration. The platform's features include tasks, chat, whiteboards, spreadsheets, and document collaboration, all on a unified platform. Starting a new business can be overwhelming, and ClickUp makes many things easier, including operations, sales, IT, marketing, HR, and even design. I particularly love the project management tools. I have a team of people who I work with to keep this channel and all the other projects we have here running. And we are using the project management tools in ClickUp to manage multiple projects efficiently, including our online courses, YouTube content planning, and even the hiring of new team members. My team loves the connected workflows, real-time dashboards, and more, helping everyone just move faster and work smarter and save time. ClickUp allows you to fast track your projects with AI, and I can plan and prioritize with ease, knowing that my team and I have visibility into all project details, including how they align to our overall goals. With ClickUp, my team sees the big picture to scope and allocate for what's important. This ensures better transparency, helping us deliver more projects faster to you and on budget. Let ClickUp help you get more done than 99% of people. Go to tryclickup.co/Raelan and use my code Raelan to get started for free. And if you love ClickUp, my code will also give you 20% off if you decide to upgrade. Oh, so much to dive in here. So many great topics that I know our audience are going to love. Where do you want to start?
Well, the talk is about the mind-body connection. It's a very different understanding than what's out there. I mean, there's a ton of literature out there. This is different, and I think you'll find it very interesting and exciting. And I think it relates to a lot of medical conditions. I'm going to start out with hypertension because that's my specialty, and it's also perhaps the most widely mind-body studied condition of them all. And we'll go into that. And then I'm going to talk about how it relates to a lot of other medical conditions, chronic fatigue syndrome, other conditions, colitis, migraine, and I think you'll find it very interesting.
This is exciting because we have never talked about hypertension on this channel, and sounds like such an untapped area of study for people with conditions like chronic fatigue syndrome and long COVID, people who are facing these mind body conditions, because it's hard for us when we're looking to find research that is looking at that mind body connection. And quite often we're piggybacking on chronic pain science because they've done a fair bit of research. So I'm really interested to hear what that looks like in the world or from the perspective of hypertension. And because even from what exists, I know you've expanded and built on and found that there are different ways of approaching this. So I'm really excited to learn about that and see how that applies to other conditions as well.
Right. And when you mention chronic pain, I'm very familiar with the work of Dr. John Sarno. And in fact, I wrote a chapter in his book, The Divided Mind. And there's a difference between what he is talking about, what I'm talking about. He makes a point you have to exclude a medical cause for a condition. I am saying the mind-body connection is about medical illnesses as well. And nobody's writing about that.
Yeah.
Let me just state my credentials. I am not a psychologist. I am not an alternative medicine doctor. I have terrific mainstream credentials at one of the best academic centers in the country, New York Presbyterian Hospital, Weill Cornell Medical College. I've published a lot of medical articles and book chapters in 3 books, including Hidden Within Us, which is about this. So I want to make clear, I think it needed a physician to come up with this. A psychologist couldn't, and I'll explain that why not. So I'll start with hypertension. Hypertension was perhaps the most thoroughly studied in terms of mind-body of all the conditions. Everybody thought there was a mind-body connection. Half a century of research, I'm going to summarize it in 30 seconds, looked at anger and anxiety, measurements of them, relaxation techniques, biofeedback. Bottom line, yes, in the moment, you get angry or anxious, pressure goes up in anybody. Relaxation techniques lower your pressure transiently, no question. But as far as hypertension, half a century of studies could not prove a relationship and could not prove benefit of all those techniques, maybe 3 millimeters, which is nothing. And with the advent of the 24-hour blood pressure monitor, that was the end of that research. And in medicine, nobody would consider hypertension a mind-body condition. And I am saying that in most patients, it is not a mind-body condition. But in some it is, but it's very different from what everybody thinks. So very, very briefly, most of hypertension is not mind-body. Hypertension is either driven by the kidneys or by the sympathetic nervous system. With the kidneys, genetic factor, hormonal factors, the salt, we treat it with diuretics, ACE inhibitors, drugs like that. And if you look up studies, these agents that target the kidneys work in about 80% of patients, and it's not a mind-body condition. In the remainder, it's driven by the sympathetic nervous system. And we think sympathetic nervous system, that's where we think emotions, because what drives the sympathetic nervous system? And if you look in the literature, what drives the sympathetic nervous system? Well, theories, inflammatory factors, genetics. But bottom line is they have no idea what drives the sympathetic nervous system in hypertension. And all the mind-body studies led nowhere. And that's where we're going to start. And I'm going to start with a couple of specific hypertension conditions in which this became glaringly important. These are not the usual cases, but it makes it so obvious. There's a condition called paroxysmal hypertension. People get sudden episodes of severe blood pressure elevation, headache symptoms, and these episodes can last for hours and hours. And they come out of nowhere. They're sitting home watching television, and the pressure shoots way up and they have a headache. It's not related to current stress at all. Often they end up in the emergency room. They get some medication intravenously, goes away, and then it comes back days or weeks later again and again and again and again. What causes it? There is a rare tumor that secretes adrenaline. It's rare. It explains it in 1 out of 100 cases, 99%. Nobody knew the cause. Nobody knew how to prevent episode after episode. So in this context, when I started seeing patients and talking to patients was eye-opening. So I'm going to mention 2 patients that really broadcast this understanding. One is a 60-year-old man, 2 years of episode after episode, no medical cause for it, wrecking his life. Take the history, no stress, married, children, money, everything is fine. He has a foreign accent. He was a Holocaust survivor. I asked him, do you think this might have any relationship to that horrible history? And he said, no, it was decades ago, and it never affected me emotionally. That phrase, never affected me emotionally. Oh my gosh, what am I hearing? And what I was hearing was that's repression of emotion. And a key point I want to emphasize is the difference, two terms that are used almost interchangeably, suppression and repression. They're day and night different. And a lot of people don't realize it. Suppression is, okay, it was awful, or I'm grieving a family member who died. And in order to get around it, you focus on other things. You focus on work. You focus on friends. You have friends supporting you. And you try to avoid as much as possible dwelling all day on that. That's suppression. It's a conscious mechanism. It's wonderful. And it's a key component of resilience. Nobody talks about repression. Repression is at an unconscious level. We don't make an effort to repress. Our unconscious mind removes it from our awareness, and we go on like nothing happened. And I'll give you a few examples of it, such as this patient. And what he taught me is that repression is a huge component of emotional resilience. And if you look up popular books on emotional resilience, they don't even mention repression. It is so under the radar of what's going on. And patients like this, psychologists can't write about them because they're not going to see a psychologist because they're not depressed, they're not anxious. So what do I do with this patient? One option is, hey, let's get in touch with the emotion. Do I really want them to do that? It's so horrible. Is it safe to do it, or is it too much? I don't know. Another option, give them more blood pressure medicine to prevent these. I can't, because in between episodes, his pressure is normal. If I increase his medicine, pressure would be too low. Third option, I thought, well, if it's a mind-body related to repressed emotions, and he just didn't get it, because people who have repressed emotions, what are you talking about? I don't have that emotion. I suggested, even though he's not aware of it, let's, in this case, try an antidepressant, see if it helps block or further push away the emotion and see if it makes a difference. He got angry at me. He didn't come back for 3 months. Came back. He said, I have no choice. Try the antidepressant. No more attacks permanently as he stays on it. And I've used that approach with a lot of patients with paroxysmal hypertension. And there's such a resistance to the idea of emotions that we don't even feel affect us medically. And an example of that is in an article I published 2 years ago. I first sent it to the Annals of Internal Medicine, which is a major medical journal, and it was immediately rejected. And it was a case series of about 25 patients. And this is a condition there's no known treatment for, 90% no further attacks on the antidepressant. Why did he reject it? As he put it, it doesn't meet our strict criteria for relevance to clinical care of the patient. What could be more relevant for a condition that nobody knows how to treat? There's just such a resistance to this idea, and this idea did not require any technology, and the fact that nobody's talking about it, that's the resistance to the idea that we harbor emotions that we don't feel and they affect us. I'm going to mention one other patient with paroxysmal hypertension, 5 years of attacks. Nobody knows the cause, multiple hospitalizations, CAT scans, MRIs, the works, got nowhere. So I'm taking the history, and I suspect there's going to be a mind-body connection because almost every patient with this type of hypertension has one. And childhood was fine, no problems. Current life, she's married, everything is good. The only thing, a previous divorce. I don't think much of divorce as trauma, but let me ask about it. No trauma, no abuse. Her husband was drinking and using pot and going nowhere career-wise, and she just didn't want to entrust the raising of their 2 children to that man. She decided to leave him. Not that much of a story, but nothing else in her history, and everybody with this condition has a story. So what about the years after the divorce? Well, she was a single parent raising the 2 children. She was their only financial support. She held down 2 jobs, and she also went back to college to get her degree. all that for several years. And I asked her, did you ever feel overwhelmed or depressed? And she said, never, never. That's repression. It served her well. And we talked about it. She came back 3 weeks later. She had been crying every day about those years. I mean, I know it seemed like I was biased in blaming it on that because, it's a divorce, but it was more than just the divorce. She cried every day for 3 weeks, no more attacks, with a follow-up of 18 years. And that taught me that getting in touch with repressed emotions is possible and can heal. So that's paroxysmal hypertension. What about plain old hypertension? Plain old routine hypertension is not mind body, as we said, except I think among those with sympathetic nervous system, attributing to sympathetic nervous system, I think there is a mind body. And there are certain patients in whom I suspect mind body, not the routine hypertension. One, young adults with hypertension. Young adults shouldn't have hypertension. If somebody is obese and strong family history, that's one thing, but a thin 30-year-old shouldn't have hypertension. Most of patients who have that, there's a story. And I'll give one story. A 32-year-old, severe hypertension, 180 over 120, given drugs targeting the kidneys, no response. Any major stress? No. Calm. He was recently diagnosed with AIDS, which at that time there was no treatment. It was a death sentence. He's not upset. I gave him medication that targets the sympathetic nervous system, alpha and beta blockers that lower pressure by targeting the sympathetic nervous system, and his pressure came right down to normal. He wasn't dealing with the reality that he had a fatal illness, and actually he wasn't even my patient. I was advising somebody who was treating him, and his pressure came right down. It was sympathetically mediated, and in young patients, I think of the sympathetic nervous system, and I often, in young patients, treat with the alpha-beta blocker instead of the usual medications. And what's interesting is the combination of an alpha and beta blocker to treat sympathetically mediated hypertension is almost absent in the literature. Guidelines on treatment of resistant hypertension don't even mention the combination because the pharmaceutical company that put out the alpha blocker wanted to get it marketed as a first step drug by itself. Big, big market. They never did studies with alpha and beta. I did a study, alpha and beta, and it's excellent. There are no other studies in the literature with their alpha blocker together with a beta blocker. So young patients, there's usually a story, I think more of alpha beta, and occasionally there's a patient who gets in touch and it cures their hypertension permanently. But again, these are patients that don't have psychological symptoms, and psychiatrists, psychologists don't see them because they don't have any emotion related to it. It's actually, the emotion is not there. Other forms of hypertension, severe or resistant hypertension. And we always look for a cause, just like in young patients, we do medical studies looking for other causes. You find a medical cause in about 10%. The other 90%, nobody knows why they have severe or resistant hypertension. The alpha beta blocker combination works well and it controls hypertension in most patients. And many of them have a story. And I'll give the most dramatic story. A woman, 48 years old, with 30 years of uncontrollable hypertension since she was 18, on 5 drugs. And even when I was seeing her on 5 drugs, her pressure 150s over 100s, never normal. And one day at a routine revisit, she comes in. She hasn't been sleeping well for 2 weeks. She's having a recurring nightmare. What's the nightmare? A man comes up from behind her and attacks her. Who attacked you in the past? So when she was 14, she was raped by her sister's fiance. She asked her father what to do, and the father said, "Don't tell anyone. We want to avoid a family scandal." She ended up hospitalized for severe pelvic infection. She was never able to bear children. That day in my office was the first time she had mentioned it to anybody. And I measured her pressure, 240 over 150. I wanted to hospitalize her. She refused, agreed to come back the next day, had a good night's sleep. Next day, her pressure was in the 120s. It was normal. I eliminated 3 of the 5 medications. Her pressure remained normal in the 120s. I did refer her to a rape counselor. And see a patient like that, you never forget it. And again, the problem is a lot of patients are not going to see a psychologist because they don't have emotional symptoms. And it is so powerfully repressed. And the idea that emotions we're unaware of affect our health, it's hard for a lot of people to believe. And that's why I'm bringing it and discuss some of these cases in the book, because yes, we can harbor powerful emotions, and the emotions we repress are so much more powerful than the emotions our mind allows us to experience. So I want to stop about hypertension and move on to other medical conditions now.
Before you do, this is fascinating. I'm just thinking about if it's something you're not aware you have, like you're just happily living your life. You think, I'm not upset. I'm not pushing down emotions. I'm not ignoring things in my life. So you don't know it's there. So, how does someone go about exploring if this might be the case for them? And if they discover that they think it might be, I mean, I know you've talked about a couple different treatment options, but what would be your top recommended ways to approach this if they believe this is the case, whether causing hypertension or something else?
That's a very important question. And again, they didn't come to me to explore a mind body connection. And what I'm talking about is something that they've never considered. And again, regardless of decades of literature, there's no literature on the safety or how likely it is to get in touch with emotions that are completely repressed and not causing any emotional symptoms. And I found over the years ways to talk to patients. I had to learn how to talk to patients. And there are certain things to say that can be helpful. And I'll give an example of it. I'll talk about chronic fatigue, and I'll communicate what conversation I had. But what I emphasize when I talk to patients about the connection is the first thing I do is I describe what repression is, because most people are unaware of what repression is. And in fact, if you pull out any popular book on emotional resilience, you will not find the word repression in those books. They talk about support, your openness to support from others, but they don't even mention repression. And research psychologists don't even know what it is. Clinical psychologists do it. They're not seeing these patients. So it is very difficult. And let me give you an example of a patient with chronic fatigue syndrome, because I think it's in the book, because doctors can't talk to patients because they're not aware of repression and don't focus on it at all. So let's talk about chronic fatigue, and I'll give an example. Chronic fatigue syndrome. Everybody thought, oh, it's a chronic viral thing. And the studies tell us, no, it isn't. In a few cases, it is, but the majority, it isn't. You ask any physician what causes chronic fatigue, nobody knows. You ask any physician, how do you treat it? Nobody knows. And the medical literature gives you very little guidance on what to do with these patients. And chronic fatigue syndrome is horrible, and it lasts for years. Now, it's not my specialty, but over the years, I see patients with a lot of different medical conditions. And one thing I noticed among the patients with chronic fatigue is that same combination, two things, a history of adverse events or trauma or severe stress or prolonged stress in the past, combined with didn't affect them emotionally. That combination, which is repression. And that was a clue. And I saw it in most patients who I saw who had chronic fatigue had such a story. A gay man goes to work, goes home and goes to bed for the last 10 years, never been depressed or anxious. What was it like growing up gay in the rural area where you grew up? And he said, well, his father rejected him and school was torture in those days. That's trauma, but he's never been depressed. And I hear stories, somebody who was bullied year after year in school and nothing was done. And I'm going to talk about one patient and in answer to how do I talk to these patients, a woman with many years of chronic fatigue. She was a young 70 years old. And why was she referred to me? Because her blood pressure was on the low side of normal. And she was seeing a psychologist about a little anxiety. And he thought, gee, could the chronic fatigue be from a low blood pressure? So I saw her, and it's an important question. And I decided, no, it is not caused by the low blood pressure. Pressure was running 95 to 100, which is low-ish. but it did not drop when she stood. And also there were periods when she didn't have the fatigue and her blood pressure was the same. And she was very thin, and very thin people tend to have a low-ish blood pressure. So I knew there was going to be a story. Talk about childhood, physical abuse, whipping, emotional abuse from both parents. She had younger siblings, younger sisters, and she took it on herself to be there for them because she knew that they also were going through this horror. And she was their lifeline. And then I talked with her about repression. And the way I talk with patients is repression is not psychopathology. Repression is a gift. It gave you the ability to get through those years, and you were a hero to those younger siblings. It was such a gift of evolution. Evolution had to give us the ability to repress. And she says, I'm feeling teary. She said, I've never shed a tear over those years. She went home. She read my book. She met with one of her younger sisters, and they cried and cried. Her chronic fatigue disappeared. By the second visit, it was gone. She suggested she see a trauma psychologist to see if there's any further work to be done. I referred her to a trauma psychologist. At her third visit, the psychologist said something I've never heard psychologists tell a patient at the third visit: you don't need me. And what's amazing is just the awareness is the healing process. And what I tell the patients, and this is so important, if your mind, which blocked off those emotions with such a powerful barrier, is allowing you to feel the emotion, trust it. It's not going to fall apart from mere words. Trust it. And I think, as you mentioned, journaling can be important. I've suggested to patients, why don't you write a letter to that little girl that you were? And it's amazing how few patients are willing to do that. There's just a fear of doing it. But again, that powerful barrier of repression, the most powerful emotions within you are emotions you are unaware of and swear you don't feel. If that barrier allows the emotion, trust it, allow it. If you feel like crying, cry. Don't have your spouse say, oh, don't cry. Just let them give you a hug and go with it and trust it. So, and I also looked at the literature. One common finding in the literature is chronic fatigue. Every study shows increased sympathetic nervous system tone. Same thing, which is unexplained. And ACEs, adverse childhood experience scores, are much higher in those with chronic fatigue than in control patients. So everything seems to fit logically. That's a story with chronic fatigue. Other conditions, colitis. And I'm not talking about irritable bowel syndrome, which is also relevant, but inflammatory bowel disease, ulcerative colitis, Crohn's disease. It's inflammation. What causes the inflammation? Nobody knows. Is there increased sympathetic tone with it? Yes. Do we know why? No. One important point I want to make is I am not saying all these medical conditions are caused by mind, body, and all these. It's a proportion of patients that differs from one condition to another. Chronic fatigue, I think it is most patients. Inflammatory bowel disease, I don't think it's most patients, but I think it's a significant proportion. Is it 20%, 30%? I don't know. And studies don't look at that because they just look at measured emotions. There are studies, though, that suggest it: the increased sympathetic tone, increased inflammatory markers in patients who have a history of adverse events. Quick story: a patient with a past history of severe ulcerative colitis with bleeding, hospitalizations starting at the age of 8. At the age of 28, her husband points out to her, when your mother visits us, you seem to go to the bathroom a lot more. And she realized her mother was hypercritical of her from day one, right until then. And for the first time, she got furious. She screamed at her mother, if you don't stop that, you're never going to set foot in this house again. She completely lost it. Mother stopped it. Her ulcerative colitis disappeared permanently. You never hear of ulcerative colitis disappearing. This is quite a story. Another one is not a patient I saw. Medical grand rounds, and sometimes they present an interesting case and discuss it. So they presented a case of a woman in her 30s with a severe colitis, had to be hospitalized. And Well, what caused it? There were two things in the history, one thing that everybody noticed and one thing that nobody noticed. What everybody noticed is she had spent time working in the third world, and they figured she must have been exposed to something. So they did every test looking for every parasite, virus, or bacteria. All the tests were negative. The discussant then talked about the pathology and immunosuppressants and how they were going to treat her. The thing that nobody noticed is she was in her 30s. She had had a miscarriage, another miscarriage, another miscarriage, and another miscarriage. She had 2 live births, 2 boys, one of whom died at the age of 4. So after the conference, I called the physician and I said, this woman had unbelievable trauma that nobody noticed from the history. And I suspect that there could be incredible emotions locked in about that because the woman survived emotionally. And I was curious how the doctor, who was a rheumatologist, would respond. Silence, just no reaction to what I was saying. So this is the barrier. This is why this has gone unnoticed. A history like that and no reaction. Migraine. What causes migraine? Nobody knows. A lot of the followers of Dr. Sarno believe in the role of emotions and that it can help migraine in most patients. There is a mind-body connection. I recall a patient with 20, 30 years of migraine who saw me because she had recently developed hypertension in her late 40s. And again, she wanted to know why, because she was thin. Why does she have hypertension? Childhood history, horrible dysfunction in the family. And she starts crying in my office. Her blood pressure got better. Her migraines, which I wasn't even talking about, disappeared. So I think there is the potential that our most powerful emotions are related to so many different conditions and completely unnoticed. And people just have no idea. I don't have those emotions. What are you talking about? And it's time to begin thinking about it.
In your experience, in your years working as a physician, how many other doctors would you say think this way, have this knowledge, talk to their patients about these things? How common is that?
That is such a crucial question. I would answer almost nobody. A colleague of mine, we've been colleagues for 40 years, was discussing a patient in her 30s with severe hypertension that started suddenly in her early 30s. Before that, in normal blood pressure. And then in 4 years, severe heart control, kidney disease, aortic damage. She had an elevation of one hormone, thinks that's the cause. But I asked, is she married? And he said, well, she was married. She has 3 children. And 4 or 5 years ago, her husband was killed in a car crash. Oh, how long has she had this? About 4 or 5 years. Do you think it might be related to that horrible trauma? No, it's just nobody, not just, don't single out physicians. We're not the villains. It's nobody thinks of this.
Yeah. No, yeah, society at large doesn't think this way. It's really one of the things that I aim to do here with this channel and podcast is trying to get the information out there, which is why I'm so grateful that you're here speaking to people, because I have a lot of people, laymen, non-medical professionals sharing their own story, but it can carry more weight and more power when we hear it coming from the people who are in practice, seeing this with their patients and verifying that, yes, sometimes this is the case. And yes, here's what you need to do.
But you're not going to hear it from your physician.
Yeah.
Because physicians are not aware of it. It would never occur to them. And that's why, what I like about the book is that I can tell patient, you're in the book. Because of the cases in the book, there's inevitably a case or two that really strikes them. And that brings that understanding in. But the physician is not going to empathize, or it won't even occur to the physician. That's the problem. And yeah, if a patient is angry and anxious and, let's see how that relates to chronic pain, sure, they're already aware. And there's some relationship. Let's deal with the emotions. This is at a different level. And again, repression is not psychopathology. Evolution had to give us the ability to repress. Not everybody. We're in trouble if we don't repress and have to go through stuff like that. It's a gift.
So how do we get this more into conventional medicine? Like, is there published evidence that supports this way of thinking? How?
I don't know of anybody else who has published on this. And as I said, when I submitted it to the Annals of Internal Medicine, I mean, the 90% response rate for a condition that nobody knows how to treat, but the understanding is so foreign. And that's why I am writing this directly to patients, because that is such the challenge. How do we get, and again, no technology was necessary. And, you could do functional MRI studies today and maybe prove that, with repressed emotions, there are changes in the functional MRI, and that would be very interesting. But nobody's going to study that because the understanding wouldn't occur to them. And that's the challenge. I think the biggest barrier is that people never consider the possibility. And I mean, this is such a symbol of the gift of repression to our mental health. And we have to get the word out. And it's so difficult for people to get that understanding.
Well, we'll definitely share your book for people watching, listening. It will be linked in the description, so definitely go check that out. That is one good thing about where we are in this day and age, is that even if you can't get yourself into a doctor's office who has this information, the information is still available. So it doesn't mean it isn't available to you. So I definitely encourage people to check that out. Would you have any other recommendations for people watching or listening who are thinking, yes, this resonates, this is something I want to explore further? I mean, beyond the information in the book, what can they do?
For one thing, they could see a psychologist and explore it. I mean, if they see it and, hey, that's me, that's the beginning of recognition, and there is the possibility. That's one thing. Another thing is, here's another important question. If a lot of these conditions are associated with increased sympathetic tone, which is another clue, but we don't have a good way to measure sympathetic tone. In research, we can do it. Clinical practice, you can't measure sympathetic tone. There's no good, reliable means. But if it's related to repressed emotions, would an antidepressant help somebody with colitis? Would it help somebody with autoimmune disease where we don't know the cause? And there's a catch-22. Number one, there are not that many studies about antidepressants for those diseases. Number two, even if somebody's doing a study, and here's the catch-22, the patient in whom it might be most relevant because they have the most powerful emotions, but they're not aware of them, they're not going to volunteer for a study of antidepressants. The physician is not going to prescribe an antidepressant for somebody who's not depressed or anxious. So it never gets looked at. So the question is, could an antidepressant have a significant benefit to people with these chronic medical conditions? It's completely unknown and unstudied. It's another area that needs to be looked at. But the first step is to recognize we can have powerful emotions that we're not aware of. And what a blessing. What a blessing. I'm so grateful.
I haven't heard it explained that way, and I really like how you shared that it is a blessing to have these repressed emotions. And when you do start to feel them, don't be scared. It's okay, because your body was protecting you and now feels that you are in a place that it's safe and you can feel them and let them out. And I just, right there is such a powerful takeaway.
And it's amazing how when patient gets teary in my office, this is a patient who's going to heal. And don't run away from it, embrace it.
And I suspect many of us have seen this in our lives. I know whether it's repressed or suppressed, but if I haven't been feeling my emotions for a long time and then I finally start to let myself, all of a sudden everything's setting me off. I'm crying at a TV show. I'm crying at a song on the radio. I'm like, what is going on? But I'm just finally letting it all out. And I just try and trust it. Be like, okay, yes.
Yeah.
Get it out. Right now I feel like I'm safe and I can do it. So I'm just going to keep letting this out.
Yeah. One other point also. It also depends how one's current life is. And repression has enabled people to have a stable life. But if somebody's life is completely unstable, that's not the circumstance to deal with powerful emotions like that. But otherwise, it's just wide open to be explored and nobody's aware of it.
Yeah. This is incredible. Thank you so much, Dr. Mann. This has been really eye-opening. It's so wonderful to hear your perspective and your experience from all these different conditions, and just to keep getting that conversation going and getting people thinking about this, because I'm sure we have millions of people in the world who could benefit from this understanding, but they're just not going to get it from their doctor or mainstream society. So just really appreciate you being here. So thank you so much.
You're welcome. My pleasure. Thank you.
And we will link your book and any information that people need to get a hold of you, of course, in the description. So highly encourage people to check that out. And for those of you watching, if this interview resonated, I'm thinking about another doctor I interviewed, Dr. Rebecca Kennedy. I can link it up here. She's also working with her patients from a mind-body approach and has some insights definitely to share as well. So yeah, thank you again, Dr. Mann.
Happy to do anything to get the message out.
Definitely appreciate that. And thank you to those of you watching. I really appreciate you. Hope you're doing well, and hope to see you in this next video with Dr. Kennedy.